Cellulite that has the FDA clearance for up to 2 years. Now I say up to 2 years because that's as far as we've gotten with the patients in the clinical trial. We're about to get clearance for 3 years. We're just waiting on that. So this is a long-term successful procedure, so keep that in mind. Like I said, he's the only one in Fort Worth, so you're in good hands. A lot of you are pre-existing patients, so you know how great he is. That's why you're here. That's why you've come back. That's why you're curious. Okay, so you're not alone. 64 million women ages 25 to 54 in the U.S. 85% of those women have cellulite. Everybody. It does not discriminate sizes, shapes, ages, hair color. It doesn't matter. We all get it. It's one of those things where it doesn't matter how skinny you are or how large you feel, you have it. I know that I've struggled with it for forever, and I look at people and think there's no way that they have cellulite, but when they sit down, just gravity. Or when you stand up, gravity. And when you feel like you lay down, you feel fine and everything's kind of in perfect place and you think it's going to stay there, and then you stand up and you're like, oh my gosh, where did that come from? So of that, 23.7 million women are actually interested in minimally invasive procedures. So people want to get rid of this. They're trying to find something because it's emotional. It's something that is causing self-confidence issues. Maybe you're choosing to wear a different style short, or maybe you're choosing to wear a different style dress than you'd like to. Maybe you feel like you can't wear something specific during the summer because you're worried about what it's going to look like on you. It's something we all kind of deal with. This next statistic, 86% increase in butt augmentations. Thank you, Kim Kardashian. Due to her, Nicki Minaj, Jennifer Lopez. The hiney is a big hot topic right now. I mean, if you look in the magazines, everybody's zooming in to see what people's heinies look like, which of course is making all of us think about our hiney. Other people are looking at our hiney, those types of things. All right, it's not your fault that you have cellulite, ladies. It's not something where you were once in phenomenal shape and then you gained a bunch of weight and that's why you have it. There's a lot of different causes. It can be from genetics, it can be from your lifestyle, it can be hormones, it can be weight gain, weight loss. It's not anything specifically due to what we've been hearing about, oh, well, if you just lose that weight, oh, if you just go to the gym, it's going to go away. It really is something that women are more prone to getting entirely more than men. That's just the way it is, and there's all these factors that go into that. So I think it's important that you understand the primary structural cause of cellulite. In the video, they explained it as like a rubber band that's snapping. So we have these fibrous bands that are called septae. So they're fibrous septae bands, and they are actually under the surface of your skin, and you can see right here, and they're tugging down. So as we age, and as we get older, and as things change, think of like a mattress or a tufted couch, and you can see how it kind of pulls down and it forms that ruffling. Can you kind of have that visual? That's what happens with the bands. So where that dimpling is, that's the band pulling down, and then where you actually have that hill form, which we would call the dimple, that's just the in between the next band. So that's what's happening with the dimpling and the tufting-like effect. Okay, so this is what Cellfina actually takes care of. So it is handling the root cause of the cellulite. So it's taking care of those fibrous septae bands. What it does is it actually goes in and it releases the bands. So
how does it go in?
That's a good question. So we say minimally invasive because there is invasion, I guess you could say, of an actual microblade. It's very, very small, and it's going to go in at a perfect depth that's necessary for you, and it's going to go in, it's just going to go right through that band, just like in this picture. So we see how we release it. So it goes through, it almost just severs that band, and it releases it. And when that happens, it brings that tufted couch back to the top, if you can think of that visual. So it's almost like cutting that button, and the button coming up. Does that make sense?
Mm-hmm.
That's basically what's happening. And so it's bringing everything to the surface, and the effect is instant. So it's really not something that you have to wait for. I mean, you will have some bruising, you might have some swelling, but we'll have you come back. And when you see pictures, you'll see pictures after a couple weeks, after a couple months, and it gets better and better and better, but that's just because you'll see after the bruising and the swelling goes down, you're going to have this fabulous result. So much so that 96% of patients were satisfied still at 2 years. That is like an insane, a high satisfaction rate at 2 years to have with this type of a study.
So I have two questions there on that. One is because it says in the brochure that it reduces the appearance of cellulite, which is what most advertising does to mean that it's just a topical thing.
Mm-hmm.
And you're saying this is a long term.
Yes.
Why does it just reduce the appearance if in fact it would appear that it's
Eliminated.
eliminating it? What?
How would you answer that question, Dr. Anderson?
The FDA has a lot of language that you can use and you can't use. So it's really hard for them to allow you to say it totally eradicates the problem.
Okay.
But the truth of the matter is, once that ban has been released, and I don't know how this works, it just doesn't make any sense to me at all why that wouldn't reattach, but it doesn't. And so there's, what is it, 84% satisfaction?
96.
No, at 4 months.
Oh, yes, A4.
Okay. So it just keeps getting better and better. So it truly fills in. So it's not like it's going to reattach and you're going to get that again. It really is. When she said 96% in 2 years, and they now have 3-year studies, they just haven't released what those are. But in nothing we do in plastic surgery, nothing you do in surgery, if you're having hernias repaired, it's not a 96% satisfaction. If you're having a coronary artery stented, that's not 96%. You get cataracts replaced, that's not 96%. This is astronomical. This is almost beyond belief. But the patients would contest that this truly is that good.
Which would lead then to my second question is, I noticed that you're saying that it increased, excuse me, it gets better, like 4 months it was 1%, then it got to 84, then it got to 90. That would kind of allude to the fact that it's getting better as time progresses. So is this just because they don't have a clinical trial past 2 years? Is that what you're saying, that it?
No, they actually have 3 years.
They have it.
It has been just released, yeah.
So it sounds like you're still getting better after?
It'll get better up to a point, and there's always going to be somebody who's dissatisfied, but I think anytime you have anything over 90%, and this is closer to 100%, but 90%, I think is something that really is truly good. Because a lot of the stuff we do, it works in 80% of the people most of the time, some of the time, but this is 96%.
Sure, and so if it's going from 84% in 1 year to 96% in 2 years, that would almost imply that these people there's more people that are getting better.
It's getting better as time goes on.
Okay.
Right?
Do you have a question?
Yeah, what about if patient gain more weight, after that
Yeah.
procedure, so how is it going to be?
So we actually have some photos in here and you'll get to see some of those. We've got patients and we have their weight, some that have lost weight, some that have gained weight, and you'll actually see that the dimples that were treated did not come back after gaining more weight, which is something we've been our psyche has been told, when you gain weight, you're going to get cellulite. When you gain weight, you're going to get cellulite. Like he said, once you release that fibrous band, they're not reattaching. So in that area where you have cellulite and you have that dimple, regardless of gaining or losing weight, you cannot form a dimple in that location. So perhaps there's a situation where he treats 5 to 10 dimples on somebody right now, and then in 10 years you get more dimples in other locations. Well, as of right now, 2 years, that dimple that was treated has not come back. Does that make sense?
Yeah. But what about the skin, when you get rid of that, then our skin is like kind of like more wrinkled that you can see,
So there's a couple different things obviously that are important to note. This is treating the cellulite, the dimpling. When it comes to having excess fat pockets, when it comes to having any type of stretch marks, this is not going to treat that. This is just treating the dimpling. And that's something that he can talk to you about in a mini consult if those are areas that you have concern with. There's obviously other modalities that I'm sure they have here, other things that he could help take care of that for you. So just make sure that you let him know what your areas of concern are, so we can definitely address the ones that are important to you.
So you're saying then that diet and exercise is not necessarily a factor in whether this is successful or not?
Right.
Okay.
I mean, obviously it's helpful. We want you to be as healthy as possible, for sure. But
But it's not predicated on that. We don't have to go out and exercise more or diet better in order for this to be successful.
that was not a
whatever.
part of the study by any means. There was
She's
no
signing
regimen.
up already, that's all you had to say.
He's like, I don't have to change my diet. I can still drink wine on Thursdays. Okay. All right. Okay. So this is just getting to the long-lasting results, which we kind of covered. So results can be seen in as little as 3 days, with results improving over time, which we had said. Now, the 3 days, you are going to have some bruising, some swelling. So that's why 3 days, you're going to definitely see some change. And then 3 months, 6 months, as you get better and as your swelling and everything goes down, it's going to get better. Results last up to 2 years at this point. And like I said, this technology has only been out for almost 3 years. That's why we can say up to 2 years, because in a little bit, once they release the information, it'll say up to 3. This is the longest FDA clearance of anything, which is really exciting. And like I said, a 96% satisfaction rate at 2 years, which is great because how many of us have tried like lotions and potions and wraps and like rolling things? And my mom told me vitamin E, and so I would like pinch the little vitamin E tablets like one by one. I'd be like, this is terrible. So I tried everything. I'm sure all of us tried something. All right. So here are some before and after photos. You can kind of see this. This is before, this is after a month, and this is after 6 months. So she's a female patient. You can see the areas right here that was treated. See all those dimples in that area? Can you see that okay, Carrie? Okay. And then you can see, oh, something's on, something just dinged. Okay, just want to make sure. So as you can see, even after 6 months, it's still great. And this is just showing how quickly you can see the results and how even after 6 months, like I said, it is still maintaining. Let's see here. Again, Cellfina treatment. So this is where we're kind of getting into, you can start to see the weight. So before, this person lost some weight, obviously between the 2-year time span. Before, 125 pounds. After 2 years, 110. This is a 28-year-old. So they treated this area right here. Again, the results, phenomenal. And obviously she did lose a few pounds. I'm sure that was helpful also. Okay, this is a situation where she gained weight. This is what you're asking, right? So this is a 49-year-old female before. These are all the dimples that were treated. And then you see that she gained about 20 pounds. And you can see the dimpling didn't come back, right? So I think that kind of answers your question for you in terms of the release of those fibrous septate bands. Here's another one, 29-year-old, 111 pounds to start and 115 pounds. So again, you can see the dimples that were treated after 2 years. What do you guys think of these? Pretty good? Okay.
But if she wants to be retreated, for some more, then she can, right? Is it limited?
In terms of retreatment, Dr. Anderson?
Yeah, basically, the only reason you would need to be retreated is if you missed one, if it was, it just wasn't recognized at the original treatment. So, as long as you treat it, it shouldn't come back.
Or if there's like a new area that you can only treat a certain area at a time, and then you came back in a few years and like, well, why don't we just go ahead and do the back of my leg now too. Here's another one, before 164 to start, and then she lost a few pounds, and you can see the dimpling, again after 2 years.
Hers doesn't seem to be
Let me go back.
as
Still have some.
as incredible as the others. So there is a different. So there's a. Hers doesn't seem to be as incredible as some of the others that you were showing it.
I don't know, some of those are pretty heavy, they almost look pockmarked, but it does appear smoother, but,
So the
but you're
different
right.
people have different results.
Well,
Well, and these aren't Dr. Anderson's, right?
yeah, she's 49, and the other one's for 29.
Dr. Anderson, what would you say about that? They feel like these
Pay
results
close attention.
aren't as dramatic as some of the others. Do you feel like maybe
That's the reason I'm looking at that.
some of that isn't just dimpling?
I don't know. Does
No,
she have
she's
an
only
acne
36.
everywhere?
She's only 36.
No, and she's a chunky.
Pop marks.
Yeah, must be chunky.
Well, if you look at this, a lot of these dimples are so close together. You see how they're just almost
Almost like a
right
line?
next. Yeah. So if you released this, it might be so much of a release that you're basically releasing everything, and then you've got this skin sliding down. They may have selected those that weren't quite so close to one another, release those, and then that would be a situation, I think, where you could come back later after you've treated those. And, if you've got this many in one small area, then you have to maybe select those.
So they consciously selected what
Yeah,
ones
because if you
to
think about
release.
just releasing all this skin, then all of a sudden it slides down. So you might have to select different areas so you still have good skin support adjacent to
Gotcha.
it.
Okay, all right.
Good question. I'm glad you said that way.
So you cannot do the whole thing at one time.
You can, but like he said, obviously he's the physician, so he understands the science behind it and the necessary protocols to take when it comes to what to release, where to release, those sorts of things. And again, these are pictures that are from our company. He has some pictures of his own, and I think that speaks volumes of what he's done, because obviously that's what you guys are here for, is it's going to be his hand working the machine. And I almost think his pictures are better, to be honest with you. So here's another one. Again, let me just go ahead and get to his photos. We can see Stephanie's hand.
Yeah.
Yeah.
I know, I'm getting a whiplash looking at
Yeah,
her.
she keeps
I-
checking on me.
I
She's
keep
like,
checking
is
to
this your
see.
butt? Okay, here we go.
That's me.
Yep.
Really?
Okay, so here we have an anonymous patient.
I wouldn't. 32 years old, get out of here.
I know, she looks like she's 12. Okay, so this is 6 weeks apart.
No, it's not
Wow.
even.
Now,
It's
what-
not even. It's
Now, what's
three.
the weight in there though?
We didn't have wait. It's 6 weeks apart. How do
It's
you
3
even?
weeks.
I mean, those other pictures were 2 years. So at 6 weeks, based on a period, that might fluctuate a couple pounds. But do you want to share your weight to even have to share?
Oh.
Tiny?
145.
Okay, so 140, and you're probably in that same range in 6 weeks.
No, 143. I was 145 when I did that.
Okay.
I think the important thing here is that it just shows that it happens quickly. I mean,
That was actually 3 weeks, I think.
Yeah, it was 3 weeks. We
3
saw
weeks,
him
not
after
6
3
weeks?
Mhm.
Uh-huh.
Okay. This is
Wow.
3 weeks, not 6.
And
so,
that also shows that the bruising didn't last very long. So
Okay.
I read on Real Self that it could last several weeks, but for me it only lasted about a week.
I just see that
for weight loss,
her side look
No,
different,
unfortunately.
So
It's
did
just different, yeah.
doctor did something to her, both of her side?
no, he only did Cellfina. So he only did. the
She's
dimples.
talking
Yeah.
about
Oh,
right
yes,
here
right here.
and right here.
Yeah.
Did
yeah,
you
right
do a
there.
lot of releases in this area?
Where?
This side?
Yeah.
You're talking about how you can see the
Kind of bottom, yeah,
indentations
round
here,
here.
but you don't see it
Look
there.
Right.
nice, I've got your marking photo right here.
No, I think that was because I was flexing in one photo and not as much in the
Okay.
other.
Okay, so here's,
You were doing a butt clinch.
Yeah, in the first photo.
Okay.
So that would be nice.
this is,
Yeah.
this is where they were marked. So, you know, today we took photos, but the best way to take the photos is with holding the